Hey, future rehabilitation support workers, ready to just crush that interview
Yeah.
and really make a difference. We're diving deep into how to make that happen.
Yeah, we're going to unpack not just like typical interview questions, but those tricky curveballs that interviewers love to throw at you.
Love it. And we're using real questions straight from RoleCatcher's database. And get this, they have over 120,000 questions. It's insane.
It is a lot, but we'll also sprinkle in some nuggets of wisdom from their Rehabilitation Support Worker career guide, too.
Okay, so first question straight from RoleCatcher. Describe your experience working with individuals with physical disabilities. I bet some people listening are thinking, what if I haven't worked in that area before?
That's totally normal to think. Even without like formal paid experience, you can still pull from things like volunteering internships or even just personal stuff.
Yeah, like if you helped out at a senior center or maybe a family member with mobility issues, those totally count.
For sure. The key is focusing on those skills you've built that transfer over, like helping with physical therapy exercises or modifying someone's home to be more accessible. Just things that show you get the challenges folks with physical disabilities
I
face.
don't forget those all-important soft skills, empathy, patience, communication. Those are huge for building trust with clients. So what about follow-up questions? Like what if they ask, can you give me an example of a challenge you encountered while working with someone with a physical disability and how you overcame it?
Oh, that's where a nice, clear story can win the day.
Mhm.
Remember the STAR method: situation, task, action, and result?
Oh, yeah, that's a good one.
Yeah, so just describe the situation quick, what you had to do, the actions you took, and then the awesome result.
And this is where RoleCatcher's AI can be a lifesaver.
Mhm.
It can actually analyze your answer and tell you how to improve and even suggest skills to highlight based on the job description.
Super useful. Like if the job description is all about teamwork, you could mention working with a physical therapist or occupational therapist to make a custom care plan for the client.
That's such a good point. Okay, next question. How do you approach supporting individuals with mental health challenges? This one feels a little more sensitive, right?
Definitely. It's so important to show you get the nuances of mental health support. So emphasize active listening, creating that safe and non-judgmental space, and knowing about resources and support networks.
The career guide actually talks about client-centered care for mental health support. What does that look like in real life?
Basically, it means getting the client involved in every step of their journey, respecting their choices, and empowering them to take charge of their mental health.
So no dictating solutions. It's a team effort.
Exactly. And don't be shy about mentioning any specialized training. You have like mental health first aid or crisis intervention. It shows you're serious about learning and can handle tough situations.
Makes sense. What about follow-up questions here? Could they dive into specific therapy approaches?
Oh, yeah, for sure. They might ask about CBT or DBT and how you'd use them to support someone with anxiety or depression. The Role Catcher Guide actually gives a good overview of these approaches.
It's like a cheat sheet. Okay, let's say they ask, can you describe a time when you had to de-escalate a situation with a client who was experiencing a mental health crisis? Now that feels like a really tough one.
Yeah, it is. You got to answer this one carefully. The key is showing that you can stay calm, assess what's going on, and follow the right safety steps. Your main job is keeping everyone safe, the client and yourself.
Right, you wouldn't want to give away private details about a past situation.
Exactly. Focus on the general idea of de-escalation, like active listening, validating the client's feelings, and just offering support. You can
Right.
mention any training you have in crisis intervention, too.
Good point.
Yeah.
And get this, RoleCatcher's AI can actually analyze your answer and suggest phrases or keywords that are best practices in mental health support. Super helpful for keeping your answer professional and sensitive.
Totally. It's all about showing your experience and your commitment to ethical and compassionate care. Okay, moving on to question 3. Can you give an example of a time when you had to manage a difficult situation with a client?
Oh, this one's giving me flashbacks to all those awkward moments we've probably all had.
Sure.
But I'm noticing a theme here. These first 3 questions are all about how you handle challenging situations. Makes sense for this kind of work, right?
Oh, absolutely. Rehabilitation support workers are always facing situations that need patience, empathy, and serious problem-solving skills. Interviewers want to know you can stay cool under pressure.
So with this question about a tough situation, you got to pick an example that shows those qualities.
Yeah.
What are some tips for picking the right story?
Easy avoid stories where you were clearly wrong or unprofessional. Pick a time when you faced a real challenge, did the right thing, and learned something from it.
So not about looking perfect, more about learning from your mistakes.
Exactly. And that STAR method comes in handy again. Lay out the situation, the task, what you did, and the good outcome.
Got it. Now what about those follow-up questions? Could they ask how you dealt with your own emotions or managed any conflict?
They could definitely go there. They want to know how you think and how you handle your emotions. So be ready to talk about how you managed your feelings, how you talked to the client, and how you resolved it professionally and with compassion.
Good advice. And again, RoleCatcher's AI can give feedback on your answer and even suggest ways to make it stronger and highlight your skills. It can even analyze the job description and point out key skills they're looking for.
It's like having a personal interview guide.
Exactly. Okay, let's tackle question 4. How do you prioritize tasks when working with multiple clients who have different needs? This is all about time management and staying organized.
It is. It can be a lot to handle all those different clients and their priorities. What you want to do is show you understand client-centered care and how to figure out who needs what first.
So explaining how you learn about each client's goals and challenges, how you make a plan that works for them, and how you stay organized.
Exactly. You can even mention specific techniques like motivational interviewing. It helps clients figure out their own reasons for wanting to change.
And I like how the RoleCatcher Guide says that client involvement isn't just about making them feel good. It actually leads to better results because they stick with their treatment plans.
Super important point. And as for follow-up questions, they might ask, how do you handle it when a client just doesn't want to participate in their care plan?
Ooh, that's a tough one. What would you say?
I'd start by trying to figure out why they're resisting. Is it fear or just not understanding or maybe cultural factors or something else? Once you know why, you can address it and work with them to find solutions.
That's really smart. And RoleCatcher's AI can help you word those answers right. It can suggest ways to emphasize empathy, problem solving, and communication, all super important when a client is pushing back.
It's a great tool. Okay. On to question 5. Can you describe your experience working with interdisciplinary teams?
Okay, so this one's about teamwork. Think about times you've worked well with people from different backgrounds, doctors, therapists, social workers, families, anyone really. It's about showing you get teamwork and respecting everyone's expertise.
Exactly. So highlight those communication skills and how you shared information and coordinated care to make sure the client's needs were met. You know, all about that holistic approach.
So like volunteering in a hospital or even group projects in school could work here. What else should we emphasize when talking about these teams?
Focus on everyone's roles and responsibilities. Explain how you communicated clearly shared information and make sure everyone was on the same page.
Got it. What about those follow-up questions? Could they ask about a time you had to deal with conflict or disagreements within the team?
Oh, they love those kinds of questions. They want to see how you handle tough situations and people. Choose an example where you were able to communicate your point of view, listen to others, and find a solution that worked for everyone, especially the client.
Finding that win-win. And don't forget, RoleCatcher's AI can give feedback and suggest ways to highlight those communication, teamwork, and conflict resolution skills.
Such a useful tool. Okay, on to question 6. Can you describe a time when you had to advocate for a client's needs? This one really gets to the heart of what it means to be a rehabilitation support worker.
Absolutely. You're often working with people who are vulnerable and might face barriers to getting the resources or care they need. It's about being their voice.
Exactly. So pick a situation where you really fought for your client, like helping them navigate a complicated system or even challenging a policy that wasn't fair.
So it doesn't have to be something super dramatic,
Yeah.
just those everyday things that made a real difference.
Right. Be specific about the challenges, the actions you took, and the positive outcome.
So showing you care about social justice and going the extra mile for your clients. What about those follow-up questions? Could they ask about ethical considerations in advocacy or challenges with power dynamics in those systems?
For sure, they're checking if you get the complexity of advocacy and can handle those situations. Be ready to talk about your approach to informed consent, confidentiality, and respecting the client's choices.
It's about being an advocate who's also thoughtful and ethical. And RoleCatcher's AI can give you feedback on how to frame your answer and highlight those skills in advocacy, ethics, and communication.
So helpful. All right, question 7. How do you ensure that clients are comfortable and feel safe in their environment? This is about way more than just a comfy chair.
Absolutely. It's about making the client feel respected, heard, and empowered. What are the key things to think about when creating a safe space?
The most important thing is setting clear boundaries and always acting professionally. Respecting confidentiality, using appropriate language, and avoiding anything that could seem inappropriate.
So setting the stage for a respectful and helpful relationship right from the start.
Exactly. And the physical space matters too. Is it clean and well lit, free from distractions? Is there a good place to sit or lie down?
The career guide also mentions thinking about cultural factors. when creating that environment. What does that mean?
Oh, it's super important to be sensitive to different cultures. Be aware of clients' beliefs, values, and customs around things like personal space touch and communication.
So like maybe adjusting how close you stand to someone or being careful about the language you use?
You got it. And be aware of any triggies or sensitivities they might have. For instance, if someone has experienced trauma, you might avoid certain words or phrases.
So creating a safe and welcoming space that works for each individual client. What about follow-up questions? Could they ask about specific strategies for creating that safe space for clients with different needs or backgrounds?
Oh, definitely. They might ask how you'd create a safe space for someone with anxiety or trauma, or how you'd communicate in a way that's sensitive to their culture and beliefs.
Okay, so showing you're tailoring your approach to each person. And RoleCatcher's AI can give you feedback on how to highlight your skills in communication, cultural sensitivity, and trauma-informed care.
Super useful.
I'm already feeling more confident just talking about these questions.
Me too.
But we've got even more to cover, so stick around for part 2, where we'll keep going with these insightful interview questions and explore the whole career path for rehabilitation support workers.
It's gonna be good.
Can't wait.
Welcome back. We're picking up right where we left off, digging into those interview questions that can make or break your chances of landing that rehabilitation support worker job.
They're so important. And as you move up in your career, understanding these concepts is even more crucial. So ready for the next one?
Hit me with it.
Okay, it's question number 8 from RoleCatcher's database. Can you describe your experience working with clients from diverse backgrounds?
This one's all about cultural competency. Super important for any good rehabilitation support worker.
It's about realizing that everyone's different and their background might affect their needs and how they approach their recovery. What should we be focusing on when answering this?
Highlight any experiences you've had working with people from different cultures, socioeconomic backgrounds, or abilities. It's about showing you get that a one-size-fits-all approach doesn't work in rehab.
The career guide really stresses cultural humility, too. Recognizing your own biases and being open to learning from your clients. It's not about being an expert on every culture, but just approaching each person with respect and a willingness to learn.
Exactly. And even if you haven't worked directly with diverse populations, you can talk about how you're ready to learn and adapt. Mention resources you'd use, like cultural competency training, or even working with colleagues who have more experience.
That's a good point. What about follow-up questions? Could they ask something like, how would you approach working with a client whose cultural beliefs clash with certain medical recommendations?
Oh, for sure. That's a real possibility. The key is to acknowledge their beliefs, really listen to their concerns, and try to bridge the gap between their values and the treatment plan.
So it's about finding that balance between respecting their choices and making sure they're getting the best care. And again, communication and trust are key.
Absolutely. You could even mention RoleCatcher's AI feedback here. It can actually analyze your answer and suggest phrases or examples that show cultural sensitivity.
Oh, that's cool. Like what?
Like it might suggest emphasizing teamwork and shared decision-making.
Makes sense. Okay, question number 9. How do you ensure that clients are involved in their own care and rehabilitation? This is about empowerment, right?
100%. Rehabilitation works best when clients feel like they're in the driver's seat, not just along for the ride. When you answer this one, really show that you understand client-centered care and how to actually do it.
So talking about things like setting goals together, making decisions as a team, and giving clients choices whenever possible.
Exactly. Give them that ownership over their recovery. You can mention techniques like motivational interviewing, too. It helps clients explore their own reasons for wanting to change.
And I like that the RoleCatcher Guide points out that involving clients isn't just about making them happy. It actually leads to better results because they're more likely to stick with their treatment plans.
That's a key takeaway. For follow-up questions, they might ask, how would you deal with a client who just refuses to participate?
Ooh, that's a tricky one. What would you say?
I'd try to understand why they're resisting. Is it fear, a lack of understanding cultural factors, something else? Once you get the why, you can address it and work with them to find a solution.
That's a really thoughtful approach, and RoleCatcher's AI can help you fine-tune that answer right, suggesting ways to show empathy, problem-solving, and those communication skills, all essential when someone's pushing back.
It's like having a secret weapon. Okay,
Yeah.
so we've done 9 questions from RoleCatcher, but interviews can be unpredictable, right? Got any tips for handling those curveball questions?
Oh yeah, for sure. You can't prepare for everything, but you can stay calm and collected even when a question throws you off. First things first, take a deep breath. It's okay to pause for a second and think,
Absolutely. No one's going to hold it against you for taking a moment to gather your thoughts. It actually shows you're taking it seriously.
And if you don't get the question or it's confusing, don't be afraid to ask for clarification.
Yeah.
Like, can you see that a different way? Or can you give me an example?
That's a pro tip. Shows you're paying attention and want to understand what they're asking.
And even if you don't have the perfect answer, just be honest and be yourself. Interviewers want someone who's genuine, passionate, and ready to learn.
So true. And remember to highlight those transferable skills. Even if you haven't been a rehabilitation support worker before, you probably have skills from other jobs or experiences that are relevant.
The RoleCatcher Guide has a whole section on those transferable skills. It talks about how communication, empathy, problem solving, and teamwork are valuable in so many fields, including rehabilitation.
It's a great resource for figuring out your strengths and how they fit the job. And RoleCatcher's AI can help you tailor your answers to specific job descriptions, highlighting the skills that matter most for each role.
It's like having a personal career coach right in your pocket. Okay, so we've talked a lot about acing the interview, but let's zoom out for a sec and talk about the bigger picture, the career path for rehabilitation support workers. The guide lays out different stages from entry-level to senior positions. It's pretty cool to see that potential for growth.
I know, right? You could start as an assistant doing basic care and support and eventually work your way up to leading a team, creating programs, or even specializing in a specific area of rehab.
That's awesome. So much room to grow and learn new things. The guide also talks about continuing education and professional development. It mentions certifications like the CRC or COTAI, CBIS, and CCM.
Those are all big deals. Having those certifications can open doors to more specialized roles and better pay. And guess what? RoleCatcher's AI can actually help you figure out which certifications make the most sense for your goals and even connect you with training programs.
It's like having a personal roadmap for your career. Okay, we've covered a lot of ground, but before we move on, I want to go back to something we talked about earlier, self-care.
Oh, yeah, that's so important in this field. This job can be emotionally demanding, so you gotta take care of yourself to take care of others.
The career guide actually has a whole section on preventing burnout. It talks about setting boundaries, finding support, and doing things that bring you joy.
You have to make your own mental and emotional health a priority. It's not selfish. It's essential for giving compassionate care that you can sustain over time.
And it's okay to ask for professional help if you need it. Therapists, support groups, even online resources, they can all be really helpful.
And don't forget about connecting with other rehabilitation support workers. Whether it's through formal networks or just getting together, it creates a sense of community and understanding.
It's all about having a support system that helps you thrive personally and professionally. Okay, we've covered so much in this part, from tackling tough interview questions to thinking about career paths and stressing the importance of self-care. But we're not done yet.
There's still more to come.
Stay tuned for part 3, where we'll go even deeper into the world of rehabilitation support workers and figure out how to create a personalized game plan for landing that dream job.
Can't wait. And we're back for the final part of our deep dive into the world of rehabilitation support work.
I feel like we've covered so much already, nailing those tough interview questions, understanding the career path, and why self-care is so important.
Yeah, we've been busy. But now it's time to bring it all together and help you create a game plan to land that dream job.
Love it. So let's revisit those career stages from the RoleCatcher Guide. Remember, there's a path from entry-level to senior positions, and each stage has its own responsibilities and opportunities to grow.
Right. Let's say you're just starting out. An entry-level rehabilitation support worker might be helping senior workers developing those rehab plans and supporting clients with personal and work stuff. Building those basic skills and getting some good experience.
So how can RoleCatcher's AI help someone at this stage?
It can actually look at job descriptions and see what specific skills and keywords employers are looking for at that entry level. Then it suggests ways to tweak your resume and cover letter to highlight those skills, even if you don't have direct experience.
So even if you're coming from a different field, RoleCatcher can help you translate your skills into something that rehab employers understand.
Exactly. And as you get more experience, you might move into a junior rehabilitation support worker role. That means more responsibility, like doing individual counseling and working more closely with those interdisciplinary teams.
So you're leveling up. How can RoleCatcher help someone who's reached that junior level?
Well, RoleCatcher can look at your experience and suggest certifications or training programs that'll boost your skills and make you a stronger candidate for those junior positions. It can even connect you with online courses or professional development stuff.
Wow, it's like having your own personal career advisor.
I like that. And as you keep learning and growing, you might become an intermediate rehabilitation support worker. Now you might be leading group therapy, creating more in-depth rehab plans, and even mentoring new staff.
So now you're the leader and the mentor. How does RoleCatcher support someone in that role?
RoleCatcher can actually help you show off those achievements and skills by suggesting really strong keywords and phrases to use on your LinkedIn profile or resume. Plus, it can analyze what's happening in the industry and find areas where you can specialize even more.
So you can really make your experience stand out and grab the attention of recruiters and hiring managers.
Exactly. And then you reach the top senior rehabilitation support worker. Now you're giving expert advice, designing awesome rehab programs, and maybe even shaping policies and procedures in the field.
That's amazing. You're like a thought leader at that point.
Yeah.
So how can RoleCatcher support someone at the senior level?
RoleCatcher can connect you with other experts, find research and articles, and even help you get speaking gigs at conferences or publish your own work. Plus, it helps you stay updated on all the latest trends and research so your knowledge stays sharp.
So no matter where you are in your career, RoleCatcher's AI can help you find success.
It's such a powerful tool. Okay, let's switch gears for a second, talk about networking.
Yeah, networking is so important, but it can be a little scary, especially when you're new. What are some good ways to connect with people and build your network?
Start with talk to friends, family colleagues, or even old professors. They might have connections in the rehab world. You never know.
Good point. It's all about using those connections. What else?
Join professional organizations that focus on rehabilitation. Go to conferences, workshops, online webinars. It's a great way to meet people who get it, learn from experts, and stay in the loop on what's new.
The RoleCatcher Career Guide actually lists a bunch of those organizations, like the American Congress of Rehabilitation Medicine and the National Rehabilitation Association. It's a goldmine for finding networking opportunities.
Oh, yeah, definitely. And don't underestimate the power of social media. LinkedIn is amazing for connecting with professionals, joining groups, and even reaching out to people who are doing the jobs you want.
It's a whole world out there. And remember, networking is a two-way street. It's not just about what you can get, it's about what you can give too.
Yeah.
Share your knowledge, your experiences, your connections.
I love that. The more you give, the more you get back. You just never know how a little kindness or a connection can come back around to help you.
It's all about creating that community of support.
Yeah.
So as we wrap up this deep dive, I want to say one last thing: believe in yourself. Becoming a rehabilitation support worker can be tough, but it's also incredibly
I
rewarding.
got this.
If you're passionate about helping people and willing to work hard, you can achieve anything. And you don't have to go it alone. RoleCatcher is there every step of the way, fixing up your resume, practicing for interviews, exploring different career paths. They've got your back. With their AI platform and all those resources, you're set up for success.
So go out there, crush those interviews, land that dream job, and make a difference in the world.
We're rooting for you. That's it for our deep dive into the world of rehabilitation support workers. We hope you learned a ton, felt inspired, and are ready to take on the challenge.
Go out there and be amazing.
Until next time.